So it's going okay by pinching it to make sure that it's giving an instant reflect back to your skin. All right, and it looks like your skin is very warm. I'm gonna check here to see if we have an instant recoil to your skin. Here you have a mole. I'm gonna use the ABCDE. The A is to look if it's symmetric or symmetric. So it looks like it's asymmetric, so that means it's not a round shape or one shape all around it. And the B is for the border. I'm gonna look to see how the border is. The border look intact, okay? There's no irritation right now that's going on around the border. And then the C is for the color, and the color looks like if it's like brown and black, okay? And then the D is for the diameter, or I mean the size, and I'm gonna use my ruler to check for the size of the mole. And it looks like it's about 2 centimeters. 2 centimeters going on both sides. And finally, I'm gonna do the E. The E is for to see if the mole is involving. It doesn't look like it's doing anything. It looks like it's the same size. And also, it doesn't look like it's elevated. Texture is very curly and short and nice. So now I'm gonna look at the scalp to see if you have any patches or alopecia. I don't see any of that in your scalp. It looks very healthy. I'm gonna look at your upper extremity and your lower extremity to see if your hair is distributed very nicely or evenly on both sides, okay? It looks like you have very fine hair and your skin is very warm. That means you have good flow going into your body. And I'm gonna look at your lower extremity as well to see if it's very nicely distributed. The surface of your nails is very nice, and it looks like it's well kept, and it's round shape. I mean like round edges, very nicely, very nice. And the lateral fold is intact. And also when I press down to your finger, it looks like you have full capillary refill, like the Shemrod test. So by having, like, put your 2 fingers for me like this, okay, evenly. So basically I'm testing to see if you have any club fingers. Usually people that have club fingers wouldn't be able to do that shape. So I can see a diamond shape right here. I have club fingers, which also means that it's a 160, you have a 160 degree at your head and your neck. It looks like they are symmetric to your face. I am not noticing any balance or off balance with your head and your neck. Very nice angle, very nice. And also there is no characteristic associated with any symptom. I'm going to look at your pupillary vision. This is your eyes that I'm looking at to see if they are symmetric. It looks like they are both symmetric on both sides. And also I will be looking at the palpebral visual, and it looks like they are symmetric as well on both sides. Look at me. That's very nice. Smile for me. Nasolabial fold right here, and that's even. Is to check your temporal arteries and your curated arteries on your neck, okay? And the way I'm gonna check for the blood flow, I'm gonna use my stethoscope to listen to any abnormalities, such like bruise, any bruise, like bruise, that's like noise. So that's what I'm gonna do. I don't hear any noise. And I'm gonna do it from the other side as well. Nope, I don't hear any groove on both sides. So I'm looking at your muscles of your neck. They look symmetric, at least from my angle. And it looks intact. Can you swallow for me to see if you're swallowing okay? Do you feel anything here? Is that normal? Okay. So what I'm gonna feel for is for if I notice any nodule. So this is your thyroid gland right here. So if you could bend to the right to see if I'm noticing any nodule. Nothing on this side, and on that side, I'm gonna lightly palpate it. I don't feel anything. Okay. I want to feel your tragus nodes on both sides, and these are the tragus nodes to see if there's any abnormality. Right here to see if they're even. Yep, they are symmetry, intact. Open your mouth for me, and can you move them from side to side? Okay. Can you drop the bottom of your mouth for me? Can you put your chin down for me as you're doing that? Okay, can you close your mouth and put your chin down? No, close your mouth and try to drop your chin down. Okay, perfect. And do you feel any tenderness? The tragus nodes right here. And what I'm doing, I'm feeling from any abnormality. Feel for the lymph nodes that's behind your ears. I'm using my finger thumb to feel for them very softly. So now I'm gonna feel for your tensor lobe that's under your jaw. If you can open your mouth, please. And now I'm gonna test for your submandibular nodes that's right under your chin. On the side. I don't feel anything. It looks like everything is okay. No abnormalities. And now I'm gonna feel for your subbilingual nodes that's right here. See if there's no abnormalities under your chin. All right, I don't feel anything. The superficial nodes on both sides of your neck right here to see if I feel anything. Thank you for putting your head back. I don't see anything. So next, I'm gonna look for your posterior nodes. And your posterior nodes is on the both side of your shoulder, right here. The one that we feel stress on sometimes. I don't see any abnormality from palpating. I'm gonna look at your clavicle nodes, or if there's any abnormalities. The sternoclavicular nodes, that's about right here. internal nodes, right here. The central lobe is right under the armpit. I'm gonna feel for the lateral nodes. Now the pectoral lobe, that's next to your breast. And the scapular nodes, that's right behind here, to see if there's any abnormalities. Epitrochlear nodes, okay? And that is right next, right here. Do you feel any tenderness?
No.
The groin lens, that is right here. I don't know if you can feel it. It's